Hi, everybody. So welcome to this presentation on Chapter 11. We're going to talk about senses. And today we're going to explore the mechanisms behind our sensory experiences, including vision, hearing, taste, and touch. So our learning objectives are to start. By the end of this lesson, you'll understand the classification of organs. All right, you'll be able to understand the classification of organs, the process of sensation, the anatomy and function of the eye, and the major visual disorders. All right, so our general sense organs are widely distributed throughout the body and are often individual receptor cells or units. And these differ from our special sense organs, which we're going to be discussing next. So our special sense organs are localized, and they include the nose for smelling, mouth for taste, eyes for vision, and the ears for hearing and balance. So our sensory receptors have different types. They can be classified based on their structure. So they can be encapsulated or unencapsulated, or they can be by types, by the stimuli they respond to, such as light, chemicals, or mechanical changes. So we're going to review what all those different types are. So here's some examples for each of those different types of receptors that are classified by the stimuli. So photoreceptors respond to the stimuli of light. So examples would be the rods and cones and the retina of the eye will detect light and then allow us to see. You have chemoreceptors, which is for chemical stimuli. So the best example of this would be taste buds on the tongue, which detect chemicals in food and beverages so that we can perceive taste. You have pain receptors, which is response to the stimuli of injury. An example of this is your free nerve endings in the skin, which would respond to any tissue damage or injury, and then it will signal pain. You have thermoreceptors, which is the stimuli of temperature change. So you have receptors in your skin, like they're called Ruffini endings and Krauss end bulbs that detect heat or cold temperatures. Then you have mechanoreceptors, which is stimulant of movement or deformation of capsules. So this would be um, like in the skin where they sense deep pressure or vibration. And then you have proprioceptors, which is the stimuli of the position of the body parts or changes in the muscle length or tension. So example would be like muscle spindles, which detect changes in the muscle length to help maintain posture and balance. So sensory pathways, all sense organs share three common characteristics. They detect stimuli, then they convert that stimuli into nerve pulses, and then they relay those impulses to the CNS where they can be perceived as sensations. All right, so our general sense receptors, uh, their distribution is very widespread. They can be single cell receptors are very common. Our skin receptors, you have your free nerve endings, which there's several different types. They can be pain, discriminative touch, tickle, temperature. These nerve endings in the skin that detect sharp pain when you accidentally touch something sharp or extreme cold when you hold ice. So tactile is the Meissner uh, corpuscle. This is fine touch and vibration. So example would be like receptors of the fingertips that can detect texture or of the like soft fabrics. Then you have your bulbous, which is Ruffini corpuscle. This is touch and pressure. So this would be like receptors in the skin that sense a sustained grip, such as holding a cup or holding a cup of coffee. Then you have your lamellar or the Pacini corpuscle. This is also its pressure and vibration. So this would be like receptors in the palm that detect vibration when using like an electric toothbrush. And then you have your bulboid or the Krauss corpuscle, which is touch. So this would be like receptors in your lips that sense like a gentle touch, or like the contact of a soft kiss. So these receptors work together to provide a comprehensive sense of touch and perception of your physical environment. So here's an illustration of um, some of these receptors that are in the skin. So general sense receptors are widely distributed throughout the body, detecting stimuli, again, like we've talked about, touch, pressure, temperature, and pain. And these receptors provide critical information about the state of our body and the surroundings. So, for instance, you can see in this illustration where the free nerve endings are, and those detect pain and temperature, while the encapsulated receptors, like the Meissner, that you can see on the right side of the screen here, those respond to light touch. All right, so modes of sensation, you have your muscle receptors, so like your Golgi tendon receptors. Um, this is the proprioception um, type. So an example for Golgi tendon organs, they're found at the junction between muscle fibers and tendons. So when you're lifting heavy object, these receptors detect the increase in the muscle tension. And if the tension becomes too great, then they'll send signals to the spinal cord to stop the muscle contraction to prevent potential muscle damage from that excessive force. So, like, imagine if you're attempting to lift really heavy weight that's just too heavy. The Golgi tendon organs sense the dangerous level of tension and they trigger a reflex that makes you drop the weight to help protect your muscles and tendons from being injured. Then, when we look at the muscle spindle, it's also proprioception. So example is the muscle spindles are sensory receptors that's located within um, within the muscles, and they detect changes to muscle length and the rate of that change. So, for instance, when your doctor taps your knee with the reflex hammer and the quick stretch of the quadricep muscle activates those muscle spindles, and that gives you that knee-jerk reflex. Um, so another example is if like you're walking on uneven ground, those muscle spindles help your body to adjust muscle contractions to help keep your balance by constantly monitoring that muscle length and making adjustments as needed. Then when we look at the deep receptors, we look at stretch or pressure receptors, which is in hollow organs like in the stomach. So for example, the stomach stretch receptors. So those receptors, they're located in the walls of the stomach to detect stretching as the stomach fills with food. So after eating a meal, those stretch receptors in your stomach send signals to your brain indicating that you're full, which helps regulate appetite and prevent overeating. Another example is in your bladder stretch receptors. So there you have those receptors located in the bladder wall, and they detect when the bladder is filling with urine. And then the increased stretch in the bladder wall sends a signal to your brain. This is that you need to urinate. Then we look at chemical receptors. Um, we are looking at they detect pH, carbon dioxide, and other chemicals. So these receptors can detect changes in blood pH, again, carbon dioxide, oxygen levels. So during like exercise, your CO2 levels in the blood increases, which lowers your pH. So those chemoreceptors sense this change and they send a signal to your lungs or your respiratory center in the brain to increase breathing so that you can help expel that CO2 and take in more oxygen. Another example would be um, like your central chemoreceptors in the medulla oblongata. So they monitor the pH of your cerebrospinal fluid as an indirect measure of CO2 levels. So if your CO2 level rises in the blood, again, causing the pH to drop, then those receptors stimulate an increase in ventilation to help restore that normal CO2 and pH levels. All right, so there can be several disorders of your general sense receptors. So when these general sense receptors are damaged or impaired, it can lead to a loss of sensation or inappropriate responses to stimuli. So, for example, if you get third-degree burns, it destroys those pain and touch receptors. And then while conditions like neuropathy can also cause loss of feeling in extremities, increasing the risk of injury. And then you can also have temporary impairment with when blood flow is slowed or limited to those areas. All right, so now we're going to switch and talk about the eye. So let's focus on the eye. We're going to talk about the different layers. It has the sclera, the choroid, and the retina, and then also has components like lenses and cornea that we're going to be talking about. And those structures work together to focus the light on the retina for vision. So the eye is composed of those three main layers. Again, the sclera, the choroid, and the retina. And the sclera often is called the white of the eye, and that's what provides the structure and protection. And the choroid contains the blood vessels that nourish the eye, and the retina houses the photoreceptors that capture light and convert it into neural signals for the brain to process. So here is an image of the eye and its function and its anatomy. All right, so when we talk about the retina, it's the light sensitive area at the back of the eye, and it contains rods, which are responsible for vision and low light, and cones, which detect color and detail. These photoreceptors, they convert light into electrical signals, which are then sent to the brain via the optic nerve for interpretation. And the cornea and lens are transparent structures, and they work together to help focus light on the retina. The cornea is the outermost part that bends light, while the lens adjusts its shape to find tune focus, and that process ensures a clear image is formed on the retina. So here is just an image of the retina and how those work together. All right, so our visual pathway, so the optic nerve is the crucial pathway that carries that visual information from the retina to the brain. So any damage to that optic nerve can disrupt that signal and lead to partial or complete vision loss. So it's like a cable connecting a camera to a screen. So it just transmits what the eye sees to the brain. This is an image of that so you can see where those optic nerves are coming from the eye and go up to the brain into the occipital lobe in the visual cortex. All right, so then we're going to talk about visual disorders. So vision can be affected by disorders like cataracts, myopia, hyperopia, and astigmatism. So we're going to talk about each of those in more depth here as well. All right, so visual disorders, they can affect various parts of the eye. Like cataracts is a clouded lens that can impair vision. And this is what this image is showing there. This is an eye exam and what they're looking like and what different disorders would look like. All right, so the eye does contain two fluid-filled compartments, the aqueous humor and which is in the anterior segment, and the vitreous humor, which is in the posterior segment. And these fluids, they help to maintain the eye's shape and provide nutrients to the internal structures. Any imbalances in the fluid pressure can lead to conditions like glaucoma. All right, so here's examples of refraction disorders. So myopia is also called nearsightedness. So a person who has myopia can clearly see objects up close, like text in a book, but they would struggle to see distant objects, such as like road signs while they're driving. The cause is the elongation of the eyeball. It causes the light to focus in front of the retina instead of directly onto it. Um, Hyperopia is farsightedness. So this is a person who can see distant objects clearly, but then they would struggle to focus on close tasks like reading or like threading a needle. The cause is the shortened eyeball that causes light to focus behind the retina instead of directly onto it. So this is common for like older adults who find it difficult to read like a restaurant menu. They have to hold it at arm's length or put on their reading glasses. So astigmatism is a person who experiences blurred or distorted version at all distances. So letters or shapes, they may appear stretched or uneven due to irregular shaped cornea or lens. So the cause of this, again, is uneven curvature of the cornea or lens, which distorts the light as it enters the eye. And so it prevents it from focusing properly on the retina. So someone with astigmatism might notice that lights at night, such as headlights or streetlights, appear streaked or have halos around them. And then cataracts we've kind of talked about, but this is when a person may report cloudy or blurred vision, as if looking through fogged up window. Colors may also appear faded or less vibrant. And the cause is protein buildup in the lens of the eye, which forms cloudy spots and blocking or scattering light from reaching the retina. So an example is like an older individual may struggle to read or drive, especially at night, and notice increased glare from oncoming headlights. So this is just an illustration of the different eyeball shapes that would cause those different disorders. All right, so this refraction disorder is strabismus. So this would be like a young child who might have one eye that turns inward or cross-eyed or outward while looking, the other eye looks straight ahead. So this misalignment may become more noticeable when they are tired or focusing on objects. So when they have a convergence or cross-eyed, the child's right eye turns inward while reading or looking at a toy, while the left eye remains focused straight ahead. And so this is often referred to as estropia. And then divergence is outward eye turn. So, like an adult's left eye drifts outward when trying to focus on a distant object, such as like watching TV, and this is referred to extropia. So if untreated, it can lead to what's called lazy eye or amblyopia. And this is where the brain starts to ignore visual input from the misaligned eye to avoid double vision. And so over time, this can cause permanent vision loss in that affected eye. So to correct it, treatment options are glasses or patching the stronger eye, vision therapy, or corrective surgery to realign the eyes. And early intervention in childhood is especially important. This is an illustration of what that would look like. All right, so disorders of the retina. This is the like light sensitive layer at the back of the eye that plays a crucial role in vision. So these conditions can significantly impact vision and often require early diagnosis and treatment. So retinal detachment, this is a condition where the retina separates from the underlying layer of supportive tissue. This can happen due to age, trauma to the head, or eye tumors. It is a medical emergency that can lead to permanent vision loss if it's not treated promptly. You have diabetic retinopathy. This is a complication from diabetes mellitus, and it damages the retina through hemorrhages and the growth of abnormal blood vessels. And this condition is a leading cause of vision loss among adults and highlights the importance of managing diabetes effectively. Glaucoma occurs when increased intraocular pressure reduces blood flow to the retina. So over time, this pressure can lead to retinal degeneration and vision loss. Regular eye exams are vital to detect this early. And then you have nyctopia, which is night blindness. And that's just the inability to see well in dim light. And it can result from retinal degeneration or lack of vitamin A in the diet. So ensuring sufficient vitamin A intake, and addressing underlying retinal issues can help improve your night vision. Then we have age-related macular degeneration. So this is a progressive condition that affects the central part of the retina, called the macula. And the macula is essential for sharp, detailed vision that we rely on for tasks like reading and recognizing faces. And so as this progresses, individuals may experience blurred or distorted central vision. And And age is the most significant risk factor, but also is smoking, genetics, and cardiovascular health. And then color blindness primarily affects how we perceive colors. So most forms of color blindness are inherited. It's usually red-green color blindness being the most common. And this condition is X-linked, meaning it's more common in males as they only inherit one X chromosome. The inability to perceive certain colors like reds and greens is caused by abnormalities in the photopigments of the cones, which are those specialized cells responsible for color vision. All right, so now we're going to talk about two conditions that highlight complexity of our visual system. So the scotoma and visual impairments caused by CVAs or strokes. So scotoma it refers to the loss of vision in a specific area of the visual field. Um, so certain nerve pathways are damaged. The result can be loss of only like the central visual field. So leaving the surrounding areas unaffected. This can be challenging because we rely on our central vision for detailed tasks like reading and writing and faces. It usually arises from conditions like optic nerve damage, retinal disorders, or even brain injuries. And then visual impairments from CVAs or cerebral vascular accidents or strokes um, can damage visual processing centers in the brain, which would disrupt the ability to interpret visual information. So, specific example of this is acquired cortical color blindness. That's a condition where individuals lose the ability to perceive colors due to the damage in the brain's color processing region. Um, and it often occurs when oxygen levels are insufficient during a stroke. Now, here's a color vision screening. So you should be able to see different numbers within those two examples. All right, so now we're going to move on to the ear. So the ear is both a hearing and equilibrium organ. It's divided into external, middle, and inner ear with structures like ossicles and cochlea playing critical roles in sound transmission and balance. And we're going to talk about each of those divisions of the ear. And here is um, an illustration of the different anatomy of the ear. All right, so the external ear is the outermost part of the ear that plays a critical role in hearing by capturing sound waves and directing them to the ear canal. And it consists of three main structures. So you have your auricle or pinna, and that's the visible part of the ear made of cartilage and skin. Its shape helps collect and funnel sound waves into the ear canal. And then it also enhances sound localization. So it allows us to identify where sounds are coming from. Then you have your external acoustic canal or the ear canal. And that's a tube-like structure that extends from the auricle to the eardrum. It is lined with skin, tiny hairs, and glands that produce cerumen, which is earwax. Cerumen protects the ear by trapping dust and preventing the entry of foreign particles, and it amplifies certain sound frequencies to aid in better hearing. Then you have the tympanic membrane, which is the eardrum. It's technically part of the boundary between the external and the middle ear, but it's a thin, delicate membrane that vibrates when sounds hit it. and transfers that sound energy to the middle ear. And this is what uh, it looks like when they're doing an ear exam. And here you can see where the eardrum or the tympanic membrane is swollen from like a ear infection. And then this is the cerumen or earwax and what it looks like in the ear. Right, so the middle ear is part of the ear located between the external ear and the inner ear, and it functions primarily to amplify and transmit those sound vibrations from the eardrum to the inner ear. So it has a tympanic cavity, which is an air-filled chamber located within the temporal bone, and it houses the auditory ossicles, which are the small bones responsible for transmitting those vibrating sounds. You have auditory ossicles, those small bones. Um, there's three of them. You have your uh, malleus or the hammer, which is attached to the eardrum to receive the vibrations and then transmit them to the incus. The incus or the anvil is the middle bone, which connects the malleus to the staples, and the staples or the stirrup is the smallest bone in the human body, and it transfers vibrations to the oval window, which is a membrane leading to the inner ear. Then you also have the eustachian tube, which is the auditory tube. And it's a narrow tube that connects the middle ear to the nasopharynx or the upper part of the throat. And it helps to equalize air pressure on both sides of the eardrum so that you have proper vibration of the eardrum. So this is also why when you swallow or yawn, it helps relieve that ear pressure during altitude changes. Then the oval window or round window. So you have the oval window, which is the membrane that covers the opening that receives vibrations from the staples and transmits them to the inner ear. And then the round window is another membrane that is covering the opening that helps dissipate sound waves after they travel through the inner ear. Okay, so inner ear is a complex and delicate structure. It's located within the temporal bone. It's responsible for two things, for hearing and balance or equilibrium. The inner ear converts sound waves into electrical signals for the brain to process, and it helps maintain the body's sense of spatial orientation. So the inner ear consists of the bony labyrinth, which is the outer shell, which is filled with fluid called um, perilymph, and a membrane and membranous labyrinth, which is a soft structure within, which filled with another fluid called endolymph. So these two fluids are really crucial in helping to transmit sound and maintain balance. So the endolymph is found in the cochlear duct and the semicircular canals, and it's essential for stimulating the hair cells. And the perilymph surrounds the scala vestibuli and the scala tympani, and it helps to cushion the inner ear structures. Um, so when we look at the bony labyrinth, we have the vestibule, which is the central chamber that helps connect the semicircular canals in the cochlea. You have your semicircular canals, which is a three-loop like structure that's responsible for detecting rotational or angular movements of the head. And there are specialized receptors for balance, and these are called the cristae ampullaris. And this is these receptors are stimulated when the fluid or the endolymph moves during head rotation. And then you have the cochlea, which is that spiral-shaped organ that's responsible for your hearing. And then we can talk about the organ of Corti. So this is located within the cochlea, and it contains sensory hair cells that are essential for hearing. And these hair cells respond when bent by the movement of the endolymph liquid. And then the bending of those hair cells, it generates an electrical signal that's transmitted to the brain via the auditory nerve that allows us to perceive that sound. All right, so this is an illustration of all those things that we just talked about. You can see the semicircular canals, the vestibule, the cochlea. This is the effective sound waves on the cochlear structures. And then when we talk about equilibrium, this is our sense of balance. And the inner ear is key in maintaining that sense of balance. Um, so there are mechanoreceptors that are responsible for detecting balance that are located in two main structures of the inner ear. So in the sac-like vestibule and the three semicircular canals. So those structures work together to provide information about the position and movement of our head. So the vestibule contains specialized receptors that detect linear movements. So like when you accelerate forward in a car or move up and down in an elevator. And those receptors are sensitive to changes in gravity and help keep us upright and steady. The semicircular canals, those are those three loop-like structures, and they're oriented in different planes to help detect rotational or angular movements of the head, such as turning your head side to side or nodding. And inside each of those canals, the endolymph fluid moves when your head rotates. And so that stimulates the mechanoreceptors, called those crystal ampullaries, to send signals to the brain to help coordinate your balance. All right, so static equilibrium, that refers to the ability to maintain your balance and stability when the body is at rest or in a stationary position, and is primarily concerned with detecting changes in head position relative to gravity. So when you're standing still or tilting your head forward or backwards. All right, so dynamic equilibrium is it refers to the ability to maintain balance when the body is in motion. So, particular during rotational or angular movements, so it allows the body to detect and respond to changes in direction, speed, and rotation to help stay balanced. So, examples would be balancing while spinning in circles, stabling yourself when turning your head quickly, or maintaining your orientation when running or moving on like curved paths. All right, so some examples of hearing disorders um, are examples of conduction impairments. So you could have blockage of the external or middle ear. So this would be like buildup of the cerumen or the earwax in the external auditory canal that can block sound waves from reaching the eardrum and cause temporary hearing loss. An example could be like also a benign tumor in the ear canal or middle ear that obstructs sound conduction. You have your osteosclerosis, which is when a person inherits this, where the stapes bone in the middle ear becomes fixed due to abnormal bone growth. So this condition starts with tinnitus, which is ringing in the ears, and then later leads to progressive hearing loss. And then osteitis is ear ost osteitis is ear inflammation. Um, so you have otitis externa, which is called swimmer's ear, and that's infection and inflammation of the outer ear canal caused by water remaining in the ear and then fostering bacteria. Another example is ostis media, which is a middle ear infection. It's pretty common in children where you get fluid buildup due to infection that causes swelling, blocking sound conduction, and can result in temporary hearing loss. All right, so nerve impairments, examples are presbycusis, which is age-related hearing loss. So, example is like older adults struggling to hear high-pitched sounds, such as ringing phone or chirping birds. And this is due to gradual deterioration of hair cells in the cochlea as they age. You have progressive nerve deafness from chronic loud noise exposure. So examples would be like a construction worker who develops hearing loss after years of operating heavy machinery without ear protection, and those loud noises damage the sensory cells in the cochlea, or like musicians who experience difficulty hearing certain tones after prolonged exposure to like amplified music during live performances. Equilibrium disorders. You have like vertigo and dizziness. So this is like when a person feels like the room is spinning after quickly standing up or changing positions, and it's a common symptom of vertigo associated with an inner ear imbalance. Um, Inner ear infections. So an example is like individuals who might experience sudden dizziness, nausea, or trouble maintaining balance due to inflammation or infection of the inner ear. Then you have Meniere's disease, which is when a person suffers from recurring episodes of intense vertigo. They have ringing in the ears, which is tinnitus, hearing loss, feeling of fullness in one ear caused by fluid buildup in the inner ear. Um, and then disorientation and falling. So, an example, like an elderly person frequently loses their balance and falls due to like disrupted signals from the vestibular system in the inner ear. So, taste is one of our primary senses. Um, so, they rely on specialized chemoreceptors called taste buds, which detect and process flavors. So these taste buds, they're located on the tongue and other parts of the mouth. They send gustatory impulses to the brain through cranial nerves 7, which is the facial nerve, and 9, which is the glossopharyngeal nerve. Traditionally, there are 4 basic taste sensations: sweet, sour, bitter, and salty. Um, and then taste does work closely with the sense of smell, so the olfactory sense to enhance those flavors that we perceive. So, for instance, when we eat, the aroma of food combines with its taste to create that full sensory experience. And this partnership between the gustatory and olfactory senses is why food tastes bland when we have a stuffy nose. Here is a picture of your tongue and where all those taste buds are located. So, the sense of smell is powered by specialized receptors located in the olfactory mucosa of the nasal cavity. These receptors, they connect directly to the olfactory nerve, which is cranial nerve 1, which allows those signals to travel to the brain for processing. The olfactory receptors are very sensitive and can detect even tiny amounts of odor causing chemicals. So when these chemicals bind to the receptors, then they trigger that nervous signals that the brain interprets as specific odors. Um, Sometimes, though, these receptors are also easily fatigued, so meaning they quickly adapt and stop responding to persistent smells. So you might notice when you stop noticing a strong odor after being exposed to it for a while, or somebody who, you put on perfume or cologne, and then after a while you can't smell it anymore. And it's just that it's not that the smell has gone away, it's just that your receptors have gotten used to it and they've stopped responding to that. So here is an illustration of those structures in the olfactory. Then we have integration senses. So um, the integration of senses is the process by which the brain perceives and interprets those sensory inputs. So all sensory signals, whether they're from taste, smell, sight, hearing, or touch, are processed and integrated in the brain. So these inputs are combined with other sensory signals and even memories to create our perceptions of the world around us. So, for example, if you have severe nasal congestion, they can block the olfactory receptors that limits our ability to smell. So, since taste and smell work closely together, it often prevents foods from having its full flavor. And so that just shows how our senses rely on that integration to function optimally. And then as we age, structural changes, degeneration, and sensory systems can result in reduced function as well. So that can lead to diminished sensory experiences like you can't taste things as well, you can't hear as well, you may not be able to smell things as well as you used to. And that decline highlights the importance of that sensory integration and maintaining that balance and perception of our environment as well. All right, so in conclusion, our sensory systems, they work together to provide a rich perception of the world. Each sense has those specialized organs and receptors to relay the information in the brain. So thank you. If you have any questions about today's material, please reach out to me if you need any clarification. Remember to go back, read your book for further details as well.